for anybody considering the MSE and face mask and Invisalign treatment, I would say to, maybe start the face mask right away, so you can achieve that advancement as much as you can, because that was my biggest issue with this treatment. So
the number one reason I tell people to forget about the face mask often is because of the logistical inconvenience of it. I mean, it's like for 4 to 8 months, let's say, you've got to wear this ridiculous contraption on your face, and the results are essentially so slow that they're invisible on a weekly or even a monthly basis, and you just sort of have to just have blind faith that if you wear this thing long enough, it's going to hopefully budge, right? I mean, so you're kind of a case in point as to why the face mask, MSE and face mask, is great on paper, but in practice, it's just a little bit too frustrating for people to roll with it. And all right, Joshua, so we're doing a 30-minute recorded chat today. And so why don't we just get started by you telling me, your age, where you're calling from, and then we'll just dive right into it. You can let me know how I can help you.
Great. Yeah, well, I'm 23 years old, calling from Strongsville in Cleveland, Northeast Ohio area. And as you can see, I currently have a diastema, undergoing MSC treatment, and just kind of wanted to get a call with you to talk about my treatment. My main concern at the moment is I am kind of halfway through the procedure right now, and I am not really getting enough forward advancement. So my main concern was kind of just to talk to you about what your opinions were, and kind of just talk about my treatment and some of the road obstacles that I ran into as well. And hopefully we can have a productive discussion about it.
Yeah, what do you mean you're not getting forward advancement? Is that something you were expecting?
Yeah.
And I mean, obviously, the MSE is not really a forward advancing appliance. But what
Right.
do you mean when you say you're not getting as much forward advancement as you wanted?
Right. Well, I guess I can just kind of go over my whole MSC treatment. So
Before we do that, can we just take a look at you? So can you smile big for me? Like this? Okay. So your midline. Can you take your elastics out for me?
Yeah, so I have a Invisalign on the lower as well. So
Because there's something funky going on with your midline. It's looking like I'm guessing there was like some sort of asymmetric expansion, and now they're trying to use elastics to like rip your jaw back to kind of cloak the asymmetry. And the elastics were doing that, and you can tell by the midline. But why don't you go ahead and smile for me now? Now, is that a comfortable bite for you?
Keep in mind, I do have a, what's it called with the nose? My nose is crooked, so my septum is deviated.
Okay,
a little bit.
Right.
So, but yeah, so this is my current bite.
Okay.
As you can see, I'm still fairly, I'll turn this side for you.
Still, yeah, they're right on top of each other, almost in a class 3.
Right. So,
and can I see the roof of your mouth?
Yeah.
Oh, there's the MSC, huh? Lean down a little bit. Yep. Hold it right there. And are you done expanding?
Yes.
How many turns did you do? Do you know?
I did 65 turns over the course of 5 weeks. My turn protocol was 2 turns a day, starting 5 days after my procedure.
What procedure are you talking about?
So I had a surgical assist, a dome procedure prior to the MSE when they put it in. I got that done April 25th, and I had the dome procedure, and the recovery took about 4 or 5 days before I started the turn protocol. I turned two turns a day for 5 weeks, and then I started reverse pull headgear after that 5 weeks, which I've been doing for 6 weeks, reverse pull headgear every night. And I just saw my orthodontist last week, and I kind of went over some of the things with her regarding not really getting that forward advancement. And now I'm currently wearing the face mask for 3 days a week, so it can sort of hold its place, so I don't get that much recession in the meantime for another 4 weeks. And then in August 8th, I will go in, get those wings cut off, and get scanned for Invisalign.
Okay. So, so you wore the face mask for a total of 6 weeks, is that right?
6 weeks.
And you're going to get the face mask hooks cut off now?
Yeah, all the wings and the clasps are on the side here.
That's what you're hooking the face mask onto?
I actually had the same hooks that you had in your MSE, but I asked her if we can cut them off since I can just hook them to here for the remainder 4 weeks. But I was hooking them onto the front hooks as well as a few on the back. So I was wearing around, 4 to 5 bands on each side at night to try and get as much advancement as I could. But as you can see, it's still fairly close.
What type of face mask were you using?
I can actually show you right here.
Please do, yeah.
So I was using a regular face mask that you had. And when I wore it for the first couple days, it was really tough on the lower jaw. So my jaw was clicking. It felt very uncomfortable at night. So I kind of modified it and taped it to this chin strap almost to where it would sit on my forehead. And then I would get a pillow or something on my chest, which would then take the pressure off my chin, push it to my chest. And that seemed to work really well.
Yeah, good for you, man. That's very resourceful. So you basically created Sandra Khan's bow, basically. You moved the force from pushing onto your chin to pushing onto your chest.
Right. I found that way was much more comfortable than on the chin or the cheeks.
Yeah, it boggles my mind that orthodontists are even recommending these chin pressing face masks at all. It's absurd, actually, especially for an airway orthodontist to recommend them, knowing damn well that pushing the chin back is counterproductive. I don't get it. I think it's just because, some of the other face masks like the Bow and the Crane or the Grumman's face mask, they're a little bit harder to get. But, I mean,
certainly.
Yeah, it's ridiculous.
Yeah, so that was a little modification that I made, a day or two after I got the face mask, and it seemed to work well for me. So,
but you're not happy with the results that you're seeing?
I'm not. So, I've gotten a decent amount of expansion width-wise. It's been great. I could send you some photos of before my bite. But my whole top jaw was inside my bottom jaw. It was inside the mandible. And now I've gotten decent expansion. This gap has closed a considerable amount in the past 4 weeks. And, we tried to do the face mask. My biggest issue with my orthodontist was the fact that we started, 5 weeks after the dome procedure. And if I remember correctly, your interview with Dr. Tang, his recommendation is to start the face mask as soon as you see a diastema. Yeah,
pretty much. Yeah.
So
you think you started too late?
That could have been. That's my main theory. But
couldn't it be?
Everything's uncertain with MSE.
For sure, it's all kind of new and uncharted territory. Couldn't it be though that you just haven't given it enough time?
definitely could be. 6 weeks. I'm not really sure on, what the usual amount of time is, but I'll still be wearing it for another 4 weeks, and I could, maybe gain a little bit more expansion through there, even though I'm wearing it less and less.
6 weeks is not enough.
It was a short amount of time.
Yeah, it's more like 6 months, bro. Like
of face mask.
Yeah, you're just not giving it enough time. Your expectations are just not in accord with how this thing actually works. And people, the number one reason I tell people to forget about the face mask often is because of the logistical inconvenience of it. I mean, it's like for 4 to 8 months, let's say, you've got to wear this ridiculous contraption on your face, and the results are essentially so slow that they're invisible on a weekly or even a monthly basis, and you just sort of have to just have blind faith that if you wear this thing long enough, it's going to hopefully budge, right? I mean, so you're kind of a case in point as to why the face mask, MSE and face mask is great on paper, but in practice, it's just a little bit too frustrating for people to roll with it. And I had the same issue. Like, I quit on face mask after like 2 weeks. I was just like, nah, this ain't happening.
Yeah, it's tough. When you're busy, I'm also a college student. I work full time. So, at the beginning of it, I was trying to wear it 14 hours a day whenever I got home. But as I got more busier and as time went on, it started going down to 10 and then, 8 to 10. So that's certainly an issue.
Now, that being said, you are a candidate for the face mask for sure. Like, because you're essentially a class, well, your upper and lower are right on top of each other. But face mask is normally used for someone who their upper needs to come forward with respect to their lower. Because once the face mask pulls the maxilla forward, your lower teeth will keep it there. The lower teeth will stabilize the advancement you get from the face mask. So you actually are a candidate for the face mask. So if you could just hang in there and give it a couple more months to the point where your upper teeth are, instead of being directly on top of the lower teeth, they're now a little bit in front, that would then become a stable position for you. But, and I say all of this because, like, someone who's not a candidate for a face mask would be someone who both of their jaws, so their front teeth are in front of their lower teeth like they're supposed to be, but both of their jaws are just recessed. And so they want to use the face mask to bring both jaws forward, but that just doesn't work. Because what ends up happening is you might pull the upper jaw forward, but the lower jaw doesn't come with it. And then the upper jaw just slings back because there's nothing to support it in that new forward position. So you're a candidate, but you're going to have to stick with it if you want to see if it can turn out some results for you. Sounds like you're ready.
That's kind of what my...
Yeah, go ahead.
That's kind of what my main, concern was, is should I try and keep going for another few weeks, months with the face mask, or is it time to maybe think about another procedure like Lefort 1 osteotomy or MMA?
Smile for me. And from the side, please. Bro, you're close, you're close. But what I'm hearing from you is like you're like a guy who wants to get in shape, and you worked out for 6 weeks, and you're like, but bro, like, I'm not getting that much stronger. Like, I can only see four. I only got a 4-pack. I was expecting a 6-pack, and I'm only benching 185. I was expecting to be benching 250 at this point. Like, fucking, should I just quit? And I'm like, nah, bro, just give it another 6 months. Like, it's just a way slower process than you probably thought. And so, what do I think you should do? If you don't want to cut your maxilla again through another surgery, then yeah, you have no choice. You're going to have to just carve out the time to wear the damn face mask. What are you feeling?
That's what I was thinking.
Yeah, how do you see it?
It's it's tough wearing the face mask, and when you reach this point, psychologically, you just want it to be over with. But this was part of the reason I wanted to come on here and talk to you, is to kind of get that affirmation to keep going. But it's certainly something I could do. I feel like at this point in time, I might as well just keep trying to get as much while I have the bands mounted, to my maxilla. So I had the pleasure to talk to one of my long distance uncles, who's a retired orthodontist, over 4th of July weekend. He took a look at my mouth, and he thinks I still need at least another 3 millimeters, which at this point I don't think is possible, even if I did try and wear the face mask for another 2-3 months. 3 millimeters is quite a bit
of advancement.
But if I can get advancement, but I think, if I could get 1 or 1.5 millimeters, then I can get to that point where my lower jaw can hold it in place.
Your uncle is probably right that you do need probably 3 millimeters, because did he look at x-rays? Did he see that the angulation of your front teeth, your upper front teeth, that they were tipped out, and that if you wanted to kind of upright them and get them over the lower teeth, that it would, because visually it looks like 1 or 2 millimeters, but if you account for the angulation of the upper teeth, it might be more like 3. So he's probably right.
He made that estimation just based off looking at my mouth. I haven't taken any x-rays since before the procedure. So that's something I'm still waiting on from my orthodontist. But he made that estimation just by simply looking at my teeth.
Yeah. So, and whether or not 3 millimeters is possible for a guy your age with face mask, I would say the jury is out on that. No one is going to be able to give you a straight answer on that. It's probably possible, but it's going to require a freak effort on your part.
Sure.
So then I think... Yeah, go ahead.
No, go ahead.
Yeah, so you don't think you feel up to that freak effort? Is that kind of what you were getting to?
At this point in my life, unfortunately, I'm fairly busy, and that would require at least 15 hours a day, I think, at minimum, of wearing it every day, which I don't think I'd be able to achieve, unfortunately. But I'm still willing to try, if you think that wearing the face mask for at least another month or 2 can, possibly give me at least a 0.5 millimeter or something. That's certainly an option.
I can't even guarantee that another month or 2 is going to give you a 0.5 millimeter. I think if you want to do this, you just have to kind of just say, minimum 3 more months, balls to the wall, and I have no idea what's going to happen, but I'm going to go for it. It has to be kind of a no expectation plunge, leap of faith into the process, knowing that you're participating in an experiment where you're navigating uncharted territory. You're a frontiersman, and no one is going to be able to tell you what's beyond the Mississippi. You're just going to have to say, fuck it. I'm gonna go. I'm gonna cross the river. It's going to be a 3-month journey. It's going to suck. There's going to be a lot of mosquitoes and snakes and wolves and bears. But maybe there's something. Maybe there's some, a pot of gold at the end of that rainbow. Now, I think the next question, if I may, unless you want to, do you want to steer the conversation into a particular direction at this point?
Go ahead.
The next question is, what other variables are in this equation of determining whether or not you should do the face mask or whether you should look to a surgical solution? And I think that that's an interesting question too. Because remember, if you do surgery, you're going to get way more than 3 dinky little millimeters. You're going to have an opportunity to bring both jaws forward. You're going to have an opportunity to get counterclockwise rotation, which I can see visually is something, you have a long, narrow, by the way, great looking guy, Love your haircut. That's fresh. Yeah. I'm sure you have no trouble with the ladies. Maybe with that diastema, different story, but
maybe a little bit.
Before MSE and after, I'm sure you're going to have no trouble, getting through social situations in life based on the way you look. You got, beautiful dark features. You got style. You got a dope gold chain. Like, you're obviously a fucking cool dude. But you do have a long, kind of narrow face that objectively it's probably not doing your airway any favors, right? Your airway is probably constricted. And you could definitely benefit from some of this, right? Forward and then counterclockwise, right?
Certainly.
So
that was, So that was, that's a big, aesthetically, it's really not my biggest concern. I've had a considerable amount of improvement through the MSE expansion with my airways. As I mentioned, I do have a deviated septum. So I have had breathing issues in the past, but they've really gone, really improved with the MSE. I've been practicing a lot of mewing and nose breathing, especially while I work out. I'm a power lifter, so a lot of the things when you're breathing through your diaphragm, I've found an incredible improvement taking those deep breaths through my nose rather than my mouth, and that's helped a lot. Certainly.
It's amazing, bro. Can you step back so we can see your physique, your general physique? No, just out of curiosity.
I'm a pretty small.
No, you're
I'm
good.
A pretty small guy. This is a fairly big shirt.
Bro, you're an animal.
But
look at this fucking animal. Oh shit. Nah, you're an animal. So you're an athlete. What do you do?
I powerlift. So I'm currently prepping for a competition here in October. I'm around 11 weeks out, and a lot of bracing for those big movements require a large breath through the diaphragm, and having the air go through your nose rather than your mouth has significantly improved my energy and my strength. I'm a big fan of James Nestor and his book Breath and, some of his TED Talks. And he's not lying when he talks about breathing through your nose when you're doing aerobic exercises and stuff like that. So it's really improved.
That's amazing, man. What a testimonial. So I've been telling people for the past 2 years that the number one change or benefit that I've gotten from MSE is improved athletic ability. So since I did MSE, I've become a daily runner. I run 2 miles every day, and I started lifting every day. I had tried doing those things for years before the MSE, but it was just too uncomfortable for me to run, too much like weird neck and back pain and like inability to breathe. And then for things like pull-ups or other kind of exercises that require good form, it was just never really quite right as long as my airway was pre-MSE. So you are... that's quite a testimonial to those out there wondering if MSE has the potential to boost performance, which it clearly does. It does.
Certainly.
It can blow open the airway and have, take someone who's already pushing their limit. You've been trying to kind of, you probably hit a ceiling in your performance, and then MSE helped you break through that to get to a new level.
Certainly. And I also think a really large part in that is improved sleep as well. Sleeping, breathing through the nose during sleep, I think has really improved my sleeping quality, which also helps performance and, everything else that goes along with it, cognitive ability, energy levels, stuff like that. So,
Yeah. So my thoughts for you are, so you don't do contact sports, is that right?
No, not anymore. When I was younger in high school, but yeah, not anymore.
Yeah, you're better off. Football is essentially suicide. So the reason I ask is because for someone who does contact sports, double jaw surgery is going to knock them out for multiple seasons, perhaps, at least a full season. Like, you wouldn't want to take any kind of head contact at least 6 to 12 months after double jaw surgery. But for someone like you, you could probably get back into the gym within a month or two after doing surgery. Like, it's not really going to slow you down that much.
Mm-hmm. Yeah. I mean, I'm currently in prep right now for this competition, so I think at this point another surgery would be out of the question until after October, because I need these weeks to, follow my program and whatnot. But, I think it's important to consider at least. But yeah, going back to your question about, other variables, one of my other questions was, I'm right on top. So do you think there can be a fourth or a half a millimeter of advancement through tooth-borne advancement with the Invisalign?
I think so, yeah. Yeah, so
whether that be through tipping or, any other type of forward push.
Yeah, there's a giant plan C that we haven't discussed yet, and that's finagling the bagel, basically. So I've always said tooth-borne expansion should be the sauce, not the meat, right? A little bit of tooth-borne expansion is okay. It's just not okay as the primary source of expansion. You're right there, man. Like, if you could do like a mix of a little bit more face mask and then a little bit of tooth-borne expansion, and especially if you did like some bold tooth-borne expansion via something like SFOT. Are you familiar with SFOT?
Yeah.
So it's essentially, for those who don't know, it's essentially bone grafting and then expanding into the new graft. So essentially you're laying down new land and then you're pushing the teeth into that new land. So it's a safe way of doing tooth-borne expansion. You're adding alveolar bone and then expanding out into the new alveolar bone. Using that, you can definitely get into a class 1, which is proper occlusion. And yeah. If your airway is good and you're happy with the way you look, which I think for all intents and purposes you should be. Like, I definitely wouldn't go out doing double jaw surgery if I were you for aesthetics.
Purely for, yeah, right.
Just because your total package is fine. Okay? Yeah, finagling the bagel with tooth-borne expansion is definitely a reasonable option for you. So yeah, they could essentially just move those front teeth a little bit forward, tip them a little bit, and then they'll fall in front of the lower teeth.
Mm-hmm.
Yeah.
As long as, yeah, I mean, my whole journey throughout this started really was I had braces when I was younger in high school. So I've had a closed bite that was comfortable and my maxilla was in front of the mandible. But as I grew through college, my lower jaw kept growing and I wasn't really good with my retainers afterwards, as, all young kids are. And my bite started to move into that cross bite area. And that was my whole reason for kind of starting this MSD treatment. My initial plan was just thinking, I can go in, get Invisalign a little bit, expand through Invisalign, and I'll be good to go. And I was totally thrown a curveball with the MSC being introduced. And I guess I was just pretty lucky to go to an orthodontist who was an MSC provider in Northeast Ohio. And that's when I kind of got into your channel, exploring the benefits of mewing and facial health and, the functionality benefits of it. So kind of got down that rabbit hole and decided to, do the procedure because I really just wanted a comfortable bite. I felt that when I was younger, and it was something that, really bothered me. If I don't think about it, my mouth is open. So it was kind of like, when I sleep, my mouth is open when I'm not paying attention to it. And I don't want that to continue to droop my face throughout my life. And, I saw the benefits of the breathing as well, which really helped with my septum deviation. So that's kind of how I really got into this. And that's really all I need. The aesthetic benefits are a plus, but it's certainly not the reason. It was just the functionality, being able to bite on my back molars again.
Two things. Could you send me some before photos? Because I'm sure people are going to be dying to see what you looked like before, and to see if
yeah, certainly,
to see especially what happened to your mid-face, right? I'm curious because your mid-face looks good right now. You know,
thank you.
You've got some volume under
I would
your
have
eyes.
to say, yeah, I would have to say that, you know, actually I had a pretty rough night last night, so I'm a little baggy a little bit, but
nothing wrong with that.
I would have to say, I would have to say that I was a little underwhelmed with the aesthetic changes in my face. I don't really believe that I changed that much really overall. I'm sure that will change once I finish my Invisalign treatment as well, because you know that my teeth are still kind of spaced out in weird ways, and the lips, they rest on the teeth when they're moved. So I'm sure that will change a little bit as I finish out the treatment. But really, I don't believe that my face has changed that much. But that's also because, you know, I look at my face every day. So.
Well, the other thing to consider is that you had the DOME procedure, which, you know, they say eliminates mid-face expansion, right? Because do you know if you had the cuts along here?
Yep, I had the DOME
full-on
procedure.
DOME.
So I had the two cuts and then the cut in the middle.
So, you know,
which was
when they cut you there,
invasive.
They're cutting off the force vector from being able to reach the zygomas, because, you know, when you cut here and then you expand this, it's not connected to this anymore, so this doesn't get levered out with it. And so the only visual change you're going to see is in your arch, right?
Yeah. Which is, you know, and my uncle, who was an orthodontist, he recommended a LaForte 1 osteotomy. I'm not sure if you're familiar with this procedure.
Yeah, tell me about it. What did he recommend, and why did he recommend that for you?
It's essentially the DOME procedure, except they cut the entire maxilla off. So the maxilla is cut into 3 pieces, 2 on the side and then the front, and they'll cut it off. You'll have to go into this procedure with braces. So I would have to close this diastema first with braces and then get the procedure done while the braces are still on the teeth. And they'll cut the maxilla, bring it forward into position, and then they'll attach plates and screws to the cheekbones to hold it in place. And that involves no mandible procedure. That's the reason he recommended, is he thinks my position of the lower jaw is healthy. So the Fort 1 would just be a maxilla procedure. And it would involve me probably wearing bands to keep my jaw shut for 2 to 4 weeks post-surgery. So it's a fairly invasive procedure, just like the MMA, which is something that I really don't know if it's worth it at this point.
Is that what he thinks you should do? Does he think you should quit on the face mask and just do that?
Yeah, he thinks if I would have went to him, you know, if he was still practicing, he would have not even chose the MSE and just went straight to the LaForte 1 and braces. Because he believes, you know, why count on the patient to do the work when the surgeon can do the work for you, is his whole philosophy.
Yeah. So in response to that, and so I think it's a completely reasonable point to make, like, why even fuss around with the MSE when you can just go into surgery and let the surgeon expand you laterally and forward at the same time. I did an interview with an oral surgeon named Dr. Vaughn, and Dr. Ting, the orthodontist, was also part of that interview, and they addressed that question directly. And I think the answer was basically, well, MSE transverse expansion is a little bit more stable, and the force vector on the MSE is a little bit different than you would get with a segmental LaForte 1, where they cut the maxilla into 3 pieces. And so you get, I don't know if I would describe it as a sort of a deeper kind of transverse expansion with the MSE as compared to the surgery, but there is a difference there. There are benefits to doing MSE first, even in a case where you know that you're going to be doing surgery after. Because in a case where you're not even sure if you're going to do the surgery, obviously MSE is a place you would start, because maybe you can avoid surgery by just doing the MSE. Maybe the airway changes and the oral volume changes are sufficient with MSE alone, and you can avoid the more aggressive maxillary cuts. But even in a case where you know for sure that there is going to be some sort of orthodontic surgery following orthodontics, there's still an argument for doing MSE first. And I'll drop a link to that video in the description in case anyone wants to see. But it's a super interesting question, and your uncle's point is definitely, point granted.
Right. And I know that most people who do go with the MMA surgery or any other advancement surgeries usually end up doing MSE beforehand.
It's super common these days. I mean, insofar as getting access to MSE is common, which it's not, but in terms of the people who are doing MSE, the orthodontists, yeah, it's pretty common for them to, their pipeline, their workflow is MSE, double jaw surgery.
Yeah.
So I want to ask you one more question. Do you feel like you would benefit from the gains of some sort of maxillary advancement? Like, do you think that would level up your performance even more as compared to what you've already gotten with the MSE in terms of airway and tongue space?
That was actually, a question I had for you was aesthetically, there's benefits, but it wouldn't be my core reason. Are there any, functionality benefits to it? I would say that being able to bite on my back teeth. So my teeth are, they bite on the front. But when I started my Invisalign treatment on the lower, that same week I started expansion. So I've had Invisalign, and with the Invisalign in, I can bite down on my back teeth. So it's a lot more comfortable to have the Invisalign in while I'm doing this procedure. And I would say that being able to clench is much more comfortable and really helps me with energy and power when I, do performance activities. So, I would love to be able to just be able to bite down on my back teeth. I think it really helps with drive and power and stuff like that. So I just wanted to know if there was any other functionality benefits to getting that forward maxilla forward more.
So this is so in terms of whether or not your orthodontist is going to be able to get you a nice, satisfying bite like you're describing without doing a maxillary surgery, I don't know. There's ways that you can cheat that. Right now you're cheating that by wearing your lower Invisalign tray. I've done the same thing. When I had Invisalign, I would love to wear that lower tray because it would give me that contact. AGA patients get these buildups on their lower teeth so that they can have this nice contact between the upper and lower molars. See, the problem is when your maxilla is swung down like yours, and this is super common for anyone with underdevelopment of the jaws, which is basically all of us, this is what your contact tends to look like, right? It's open in the back because your maxilla is downswung, and your lower jaw, especially when we start messing around with mewing, a lot of us kind of release our lower jaws and let it come forward into this more parallel to the earth type position. That leaves us with an open bite in the back, right? So, two things. With orthodontic surgery, you get counterclockwise rotation, and that gets you this, right? That takes this, and it rotates it so that it also is flat to the earth, parallel to the ground, and now you have a bite, okay? Clever orthodontics can also do the same thing. I mean, this is a little bit beyond me, but Dr. Ting talked to me about it in the interview that we did, where he was describing a way to kind of reproduce counterclockwise rotation orthodontically through some clever, tooth movements, probably intruding certain teeth, extruding certain others, and then really working it orthodontically. Another thing that is common, it's not common, but it's out there, are people will just get buildups on their lower teeth so that they're taller and they make contact with the upper teeth.
Mm-hmm.
Like the way AGA patients do it. By the way, I'm not advocating that. I don't advocate AGA under any circumstances, but that's just, it's something that the AGA providers do, is they build up those lower molars to get that contact. Mm-hmm. So to answer your question, surgery is not the only way to achieve that contact you're looking for. It's possible your orthodontist can achieve it without surgery if she's got that sort of Dr. Ting magic. It's also possible to do it by just building up your lower molars. And lastly, it's definitely possible to do it through orthodontic surgery by getting counterclockwise rotation of the maxilla.
Mm-hmm. That was one of the questions I had for her last week. And she said, essentially, she can put a Band-Aid on it and kind of close the molars with bands attached to the buttons of the Invisalign to bring them closer. I asked her about TADs and, whether or not that was going to be needed or not. And she said that, essentially we should be able to close those molars a little bit more so they can bring to touch. And hopefully that in combination with, a little bit of expansion or a little bit of advancement with the MSE, tooth-borne advancement, can give me a Band-Aid bite, the best that she can do. So
yeah,
it's kind of where I'm at right now.
I know, man. And I know that we haven't really come to any conclusions in this chat about whether you should do surgery or whether you should just get the Band-Aid bite from your orthodontist. Honestly, my sense is that you should just... I think you should just kind of Band-Aid things and move on with your life, bro. I don't know, it's hard for me to look at a guy like you who's performing as well as you are and who's got swag like you do, and to tell you to go, ravage your maxilla with that surgery. That being said, what we've definitely concluded in this chat is that the surgery is a more elegant solution. Instead of getting you a Band-Aid fix, instead of cloaking underlying skeletal issues with tooth movement, whether that be tipping your front teeth to get you into that class 1, or whether it be, intruding or extruding certain molars to get you contact in the back, those are just, that's, orthodontic cloak work, right?
Right.
The more elegant way of doing that is to just move the maxillary bone. Is the cloak work inherently worse? In some ways it is, but does it allow you to avoid the trauma of cutting your maxilla again? Yeah, it does.
Yeah,
so
the trauma and the money as well. I've paid quite a considerable amount for this whole treatment, and that would be, kind of another double it for that procedure. So
I have a feeling that the surgeon would probably be able to get your surgery approved just based off of the angulation of your maxilla. Again, I haven't seen your x-rays, but just visually I'm guessing that your maxilla is sloped downward. That in and of itself is a clinical indication for double jaw surgery. So, or for some kind of maxillary advancement orthodontic surgery. So I have a feeling you probably wouldn't be paying that out of pocket. The surgeon could get that to be covered.
Okay.
Yeah.
That's good to keep in mind.
Yeah.
Yeah. But, I think at this point, it's worth to keep just trying. I actually might talk to her when I go back on August. And, would you think that, another month, 2 months of MSE face mask would, be worth it?
2 months. I initially said 3, but I think if you want to compromise, it's got to be 2. You have to give it a real earnest effort for 2 more months, and then you'll know. If you're still, on top of each other after 2 months of like pretty committed face masking, just drop it.
Okay. Yeah, I know. I mean, my biggest regret, I guess, was not saying anything when I started this procedure, because I did watch your interview with Dr. Ting and Dr. Vaughn, and I know that Dr. Ting did recommend starting the face mask as soon as you see a diastema, and I think that it could have been a big contributor to why I didn't get as much advancement, was because I started 5 weeks after the surgery.
It didn't help. And, another thing that I'm hearing that people are doing is they're turning the MSE back and forth to keep the sutures loose while they face mask, right? You're probably not doing that either, right? Yeah, so there's other things you could be doing to optimize the softness of your sutures through this face masking process. It's just more work, though, right? And when did you stop turning your MSE?
Right when I started the face mask. So 5 weeks of turning and then 6 weeks of face mask.
So it's been 6 weeks since you stopped turning the MSE?
Yeah.
So
it's been 7 at this point.
Yeah, I wouldn't fuck with that. I wouldn't turn that back. On my MSE scans, after it was either 2 or 3 months, you couldn't even see the split anymore. It was all filled in with bone after like 2 or 3 months. So if you start cranking that thing back, you risk, compressing whatever filled in the suture. That could be painful.
And run into more problems.
Yeah, you could fracture something. I don't think anyone's ever actually done that. I wouldn't want to be the first. So I don't think turning it back and forth.
I don't think in my case it's worth it.
No, just let it be. But that would have been another thing you could have done to augment face masking.
Mm-hmm. Yeah, and one thing I wanted to mention as well to whoever's listening, I have been practicing mewing as well, and trying to do my best to keep this advancement forward. It's really hard with the MSE to mew. I have a very calloused tongue, as I'm sure you know. It's very uncomfortable to mew with MSE in. So I'm kind of waiting to get those wings cut off to further try and do it as well, so I can have a little more space up on my roof. But I believe that, if I can be diligent throughout the next, throughout my whole life, essentially, to hold that maxilla forward so I don't get any recessment after this advancement is done, I hope that can also help.
Yeah, man, that's the goal. That's definitely the goal.
Yeah.
And, I know all about what you're talking about by mewing through appliances. I've got a mouthful full of metal myself right now. I have lingual braces and a TAD system on the roof of my mouth, and which is one of which is one of the reasons why I talk funny. I'll show you. See?
Okay.
You see all that metal on the inside of my teeth? And then, just take a look at what my tongue, usually my tongue is scalloped as all hell from the lingual braces, but you can see, right?
I can see how that can be irritating, certainly.
Yeah, that's just from the brackets.
I can show you, I think I have,
yeah, I can see the TAD indents. Yep, I remember that. Oh, dude.
It's quite painful.
Do you use wax on the screw heads?
I don't use any wax. I haven't used wax at all I kind of should have, but these are tearing up my cheeks as well on the sides and then the tongue. So I've just been kind of, powering through it. Which actually was another question I had for you. With mewing with the MSE, how was your strategy? Because I know Richard Ting talked about, or not Richard Ting, but Dr. Mike Mew talked about pushing on the roof of the mouth with what he calls the proximal third, which is that back tongue. But, since the MSE is in my mouth, I wondered what your strategy was, because I've tried different ways, pushing through the front of the tongue, kind of in front of the MSE, and then also wrapping it around almost and pushing it, behind the MSE. So I kind of wanted to know what your strategy was.
Are you able to create a suction with the MSE there, or are you totally unable to? My go-to with mewing is always to create a suction.
Yeah, it's tough with the diastema. I think it affects it.
Yeah.
Because I was a little bit before I had the diastema, I was able to suction, but it's quite difficult now.
The diastema breaks the seal?
In my opinion, yeah.
What's the easiest way for you to mew in your current situation? By pressing just
pushing through the front.
The front?
Before the MSE, in that sort of little space in the arch with the front of the tongue.
And if you go right up into the MSE, it's just too painful on your tongue?
Yeah, I mean, I still, it still touches the MSE, and I'm still pushing through the MSE. But, I wasn't sure, what your strategy was, whether to kind of, because you can almost sort of get behind the MSE in the back and push it forward, which is a little more difficult and requires a little more attention to it. But in terms of practicalness, doing it every day, pushing it in front of the MSE seems better.
So I was able to create a suction when I had my MSE. I never really had a diastema like yours. I had multiple small diastemas. I was, so I just did a suction mew hold, which is what I always do, even now. I would say to you, do whatever you can. This is a temporary situation. Any effort you can put in to doing something greater than nothing is sufficient. Don't obsess over like, oh, I need to master this, MSE specific mewing technique. Just get through it. Mew some on the front, mew some on the back when you have the time to think about it. Don't, drop a class so that you can spend an extra 2 hours a day mastering that, pushing from the back onto the MSE method that you're talking about. Just do the best you can, man, and press where you can, press where it's convenient, mew in a way that you can kind of do it even when you're not paying attention. I have a feeling that's going to be mostly just pressing up into that space in front of the MSE, which even for most people now who have small jaws in general, pressing the tip of the tongue into the front of the maxilla, not on the teeth, but just right behind the upper front teeth, is the easiest way to mew. That's fine. It's better than nothing. But obviously the first thing you should be trying to do is to create a vacuum, to create the suction, because that's always going to be the best way to mew.
Yeah, that's certainly something that is an issue at the moment. But as this diastema closes, this is actually a considerable amount. It was quite wide. I do have some pictures throughout my procedure that shows what my diastema looked like, but I didn't have any, diastemas like you did throughout the teeth. It was all just through here, which I think was a big part because I did the surgical assist.
Right, definitely. Yeah, I mean, you left the surgery with the diastema probably. Did the surgeon put in your MSE?
Yeah.
Yeah, so...
It was all one procedure.
Yeah, so how did that go? So you went in, did you go to sleep, or was it just like a sedation?
Oh, I went to sleep. Yeah, it was, they brought in an anesthesiologist simply for this procedure. So I had to talk with him. They put me under local anesthesia first, and then did an injection to knock me out cold. I had to have a breathing tube through the nose because your body can't breathe on its own. Then they went in, I believe they put the MSE in first. I could be wrong. So I believe they put the MSE in first, cortical sutures, and then did the dome procedure where they cut the top off. I could be wrong though. They could have done it the other way around, but it was all one procedure. It took about an hour and a half. And recovery was quite difficult, I would say, but I mean, it's totally worth it in regards of not knowing if you're going to get that expansion. I was way more comfortable doing the procedure knowing that I would get the chances of me getting the expansion was a lot more. The recovery was around, a week. I actually started a new job that next week, so smiling when I got in the office, smiling hurt. So I was kind of challenged there, but it ended up working out. So.
Yeah, that's crazy. So you went to sleep with nothing in your mouth. You woke up with an MSE and a diastema.
Mm-hmm.
And
it was very small, but yeah.
Were you swollen as a mofo?
Oh man, it's super swollen.
Yeah.
My whole upper and lower was quite swollen. I could send you a picture of my post-op, but it was fairly difficult. The cuts were, up here in a very unpractical place. So I was eating soft foods, mashed potatoes, and pretty much just liquids for about a week. Lost like 10 pounds.
Shit. Did it hurt like a bitch?
Yeah. It not really, not as much as I thought it was. I had, some oxycodons, as well as, ibuprofens. And I also drank a considerable amount of, THC edibles that were liquids, which helped tremendously.
Yeah.
So,
yeah, being
it helped.
being
I was
stoned
just sleeping most.
and then thinking about those cuts though would probably geek me out.
Yeah.
I don't know if that wouldn't have been my approach. Plus, I would probably be fasting after a procedure like that, so I wouldn't want to get like rabid munchies, being unable to eat. But hey, whatever works for you.
Yeah, munchies were really not on my mind, but after this procedure, I really focused on health. I was drinking a lot of protein shakes, so I do recommend if anybody does go, with the surgical cyst, get in your nutrients however you can, because it's really easy to just say I don't even want to deal with it because you don't want to get food in your cuts. You got this big clunk of metal that you're not used to. Being 2-3 months out from getting the MSE, it doesn't really feel like it's even there anymore. My speech is back to normal or at normal-ish. And, but when you're, first get that in there, it's, quite uncomfortable. So I was drinking a lot of protein shakes and trying to keep, my nutrients in check.
Mm-hmm. Yeah, that's great advice. Yeah, your speech is really good, actually, now that you mention it. My speech was terrible when I had MSE.
Yeah, it certainly was worse in the beginning because the MSE was closed, more, and it felt bigger in my mouth. But as you expand, it becomes smaller in a way because you have more volume in the mouth, and the wings are almost pushed out like that. So you do have a little more room for your tongue. Yeah,
great insight, man. That's so true. When you get MSE, everything is a moving target after that because your mouth just starts getting bigger every single day. Everything is changing during that process.
It's quite a change,
Yeah. Josh, I've actually got to jump onto another call. Is there any last things you wanted to touch upon before we hang up?
No, really, I appreciate your insight on that. That's definitely something I'm going to talk with her about when I see her, because our initial plan was to really just, cut off the wings in August 8th and get scanned for Invisalign. But I think another month or two is certainly a good step in the right direction. So, for anybody considering the MSE and Facemask and Invisalign treatment, I would say to, maybe start the Facemask right away, so you can achieve that advancement as much as you can, because that was my biggest issue with this treatment. So,
yeah, that's great advice, man. I really appreciate you sharing the lessons you've learned from your experience with others. Hundreds, maybe
absolutely.
thousands of people are going to see this and benefit from that. And thank you for your willingness to come on and share that.
Yeah, and thank you for all your content. You really helped this process a lot. I've learned a lot of techniques. I actually have your water bottle that you recommended for drinking, and wow, this thing is phenomenal. I really enjoy it, and it helps practice swallowing in a correct way. So that was huge as well. So yeah, thank you too as well.
Good, bro. I'm glad that you're enjoying that. All right, man.
So in a few months we'll get back in touch, and I'll let you know the update.
Yeah, definitely keep me in the loop and let me know what you found with the face mask, whether it was a dud or whether it ended up all of a sudden budging and getting you that space that you wanted. Very curious to hear about that.
Certainly.
All right, man. Let me know, and thanks again, and it was great chatting with you.
Yeah, you as well.
All right, Josh. Take care.